The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is Dr. Thomas O'Brien. For almost 25 years, I specialize in offering families an affordable concierge service to avoid paying costly medical insurance or unreachable deductibles without giving up premium health care. As an osteopath, I offer osteopathic adjustments alongside medical examinations. Also, I offer discounts to military and first responders. I am now accepting no-fault patients, which include osteopathic adjustments, medical treatments, and prescription services, including medical marijuana. At my practice, my patients never pay copays and still receive the most personal and complete medical care. I have spent my career devoted to providing healthcare at affordable prices. Everybody should have a relationship with their physician. I work for you and your family. The honor and privilege is mine. If you have been in an automobile accident, please call my office at 631-980-8200 for an immediate appointment. To learn more about me and my practice, visit drtomio.com. Again, I am accepting no-fault patients. Call my office for an immediate appointment, 631-980-8200. Welcome to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your health care needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you're involved in a motor vehicle accident, call my office today and schedule an osteopathic physical examination. Let me help you lead a happier and healthier life. If you wait, it may be too late. To my military family, I got your six. To my Masonic brothers, the light is bright. I'd like to welcome my co-host, Sammy, Vanni.
How you doing?
All right, how are you today?
I'm good. How are you?
All right, how you feeling today?
Good. How was your workout last night?
Oh, you like that, huh? It was good. You surprised me. You caught me off guard.
I was trying to get your attention. I didn't want to get you out of the zone or anything.
Yeah, I had the headphones on. I got my little dance going, and all of a sudden I looked to my right and hey!
Sorry.
All right. So it was a good workout.
It was a good workout.
Yeah, I got a good pump there. It was pretty good. I usually don't work out on Tuesdays. Usually I do Monday, Wednesday, Friday. If I'm too tired on Friday, then I come in on Saturday. But because of Monday, I worked a long day. I was exhausted, so I said I'll work out on Tuesday instead.
Gotcha.
Yeah, so. All right, so we have a special guest today. Would you introduce our guest?
So everyone, this is my friend Briana Norena. Briana, you want to say hi?
Hello, everybody.
All right. Well, how do you know each other?
We went to high school together. We've been friends since freshman year, and now we go to the same college.
Right.
So, and we've just been friends ever since.
And what college do you go to?
Malloy.
Yeah, Malloy, Molly.
Malloy University.
Malloy University now, yeah.
Yeah, it's a university because they're offering a lot more programs. Mm-hmm. Good. And what are you going to school for?
I'm going to school for psychology.
Psychology?
Currently.
Why'd you choose that major?
I personally like to help people and listen out their problems. I'm a huge person on listening to people's problems, lending an ear. So
okay. Yeah, that's it. You need to have those skills because it is a skill set.
Oh, for sure. Definitely listening, not trying to talk as much as I can.
Yes. Yes, absolutely. I like to talk, as you know, but you really have to listen. I always say, look, listen, and feel. So you're going to be looking at your patients, your clients, your patients. You're going to be listening to them because when you look at them, they're telling you a story, their body language. When you're listening to them, you're actually hearing an oral story. But then you're also looking at their body language to see if they're being honest or not. If they're staring off, up in the sky, off on an angle, and they're trying to think of a story.
Exactly what they're going to make up and tell you next.
Exactly. All right. So we're going to go on. We have a little advertisement.
All right. So for the next month, we're giving away 50 vouchers for a full body adjustment, including a detailed physical and spinal examination, along with the personalized adjustment treatment plan, all for just $49, normally a $250 total value. This is a limited time offer as we have had a lot of interest, so we encourage you to call the office today and schedule your appointment. We look forward to serving you.
Yes. I have a lot of listeners, and I'm thankful. This was a blessing. It was given this opportunity given to me, so I can help another platform to educate the community. I had my own TV show several years ago, and I won 4 Beta Awards for it. And that was a nice platform. As a physician, I can only reach so many people and educate them on health. Health in general. But I want to be more than just a physician. Anyone can prescribe the pill. So I was given that opportunity to have my own TV show. I give plenty of outreaches over the past, 20 years. And then I was given this opportunity a year ago and here to a new platform to educate the community. So with further ado, let's talk about today's show. Now, originally I had a topic and I decided, because of a lot of the call-ins and my emails, so we're going to continue with the question and answer. That seems to be a really hit. People are sending me emails and they have more questions or they want me to clarify information. So that's what we're going to do today.
Alrighty. So for the question, we're going to do, what is asthma?
Okay, asthma. Asthma is what we call reactive airway disease, okay? But what is asthma? All right? Asthma is there's going to be some sort of irritant that irritates the lungs, and it causes the lungs to become inflamed. And then after the inflammation, we have plug formation, okay? So inflammation, irritation, inflammation, and then plug formation, mucus plugs, okay? That is asthma.
Oh, so next question I'm going to be asking is, how do we treat asthma?
Okay, that's a good question. All right, how do we do this? Now, you need to have the proper training. I've practiced in the South Bronx for 16 years, and that's the most unhealthiest borough in all of New York City, and one of the unhealthiest in probably the United States. One of the unhealthiest. When it comes to asthma, childhood obesity, diabetes, childhood diabetes, we are the leader. HIV, we're one of the leaders. So, I trained at St. Barnabas. I always say this because I'm proud of my training, and I keep repeating myself. Well, because I'm proud. I was very, very blessed to have the mentors and the physicians who trained me. They really broadened my knowledge because of the community that I practice in. So because it is the leader, if not the leader, one of the leaders in asthma, I really had to learn asthma inside and out. And you have to look at the severity of the disease itself. If it's something like, let's say, just seasonal, then, I only have to have an asthma attack maybe once or twice a year when the weather becomes cold, when there's a little slight climate change. I can treat them with something very simple as a beta agonist, and we'll know that it's Preventa, albuterol, or Ventolin, and now we also have ProAir. So that what that does is it opens up the lungs so we can breathe better. If I start getting into like moderate, now there is a flow chart, but this is, the way I do it. If you have, like, say, moderate, then what I'll do is I'll have the beta agonist, and I'll also introduce corticosteroids, inhaled corticosteroids. And that would be like your Flovent, your Pulmicort or Asthmacort. I trained with those in the early 90s. I really don't use that. I don't even know if they make those products anymore. So I usually use the Flovent there. And what that does is it reduces inflammation in the bronchial tree, right? We said we have an irritation, inflammation, and mucus plug formation. So what I want to do is reduce the inflammation in the bronchial tree, and then we won't have an asthma attack there. If we get into something that's severe, then I'm going to have the beta agonist. I will also have like a long acting beta agonist with a corticosteroid. So it's a combination inhaler because I want to make sure that we do not have inflammation. There's other medications that I can include in that as like mast cell stabilizers, but that is how I treat. And gold standard in treating asthma is corticosteroids, inhaled corticosteroids. You can also use prednisone, okay, that's oral, okay. steroidal anti-inflammatories. I will use that often as well, but I'm conservative. I'm not too big on using the Medro dose pack. I use typically a small milligram once a day for 3 days versus the taper pack. I do, but that's just the way I treat. I'm more conservative. All right, so we have almost a minute left here. So let's just hold there and let's go into, would you like to say anything to anyone, introduce anyone, say hi or...
I don't really got anyone out there, but hi, Mom. Hi, Dad. Hi, Lou. That's really it.
Yeah. How's your sister doing?
She's good. She has her prom soon. We're doing prom dress shopping tonight.
Wow, prom. Okay. Anyone you like to say?
Hi, Chris. That's my brother.
Your brother? Okay.
Yeah,
all right. Good. All right. So we're getting ready to wind down part 1. So we're down to 45 seconds. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. Or you can give me a call at 718. That's not my office. It's 631-980-8200. And that is 631-980-8200. Or if you want to stop by my office and say hi, come by and you can see my museum. You see all my instruments. I have a lot of artifacts on my walls and it has history. So stop by my office. And that's 250 Patchogue Yappaint Road, Suite 16, East Patchogue, New York. Come by, say hi, and then you get to experience Dr. Tommy O. Welcome back to the Ask Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LA News Radio. I offer a very affordable concierge practice, which allows you access to the quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. If you were involved in a motor vehicle accident, call my office today and schedule an osteopathic physical examination. Let me help you lead a happier and healthier life. All right, so we're back on part 2. So I'd like to reintroduce my co-host, Sammy Vanni.
Hi, everyone.
All right, and we're here with a special guest.
Briana.
Hello.
All right, so both you're at Malloy University.
Yes.
Okay, getting ready to graduate? So,
yeah.
Okay.
Yeah.
Okay,
Thank
good.
God.
I know. Oh, we got to do this.
Alrighty. So the next question we're going to cover is what is obesity and morbid obesity?
Okay, good. All right. So I've covered this several times, so we know. We'll go over ideal body weight. So we must calculate your ideal body weight. Once we understand what the ideal body weight, and that's based on height versus frame. Okay. And then what we do is depending on your musculature, like a very muscular, and then I would tack on like 10%. But let's just say for the average person, I'm going to take the ideal body weight. And then if you are 10% over ideal body weight, you are overweight. That's it. 10% over ideal body weight and you're overweight. If you are 20% over ideal body weight, you are obese. If you are 100% over ideal body weight, you are considered morbid obese, okay? So it doesn't take much to be obese. Only 20% over ideal body weight.
That's insane.
Yeah. No, it doesn't, right?
Oh my God.
Yeah, I know. It doesn't take much. Remember, it's always about input versus output. Input is how much food we're consuming, okay? Because it's calories. You have to burn calories. And then the output is your actual aerobic activity, burning off those calories.
I need to go on the treadmill more.
Yeah. Well, talking about, that's good point. In the 70s, we used to say pinch an inch. Okay, that was a commercial. That was for a cereal, pinch an inch. Okay, and they used to say 3 times a week, 30 minutes aerobic activity to lose the weight. Well, not today because of the volume of food, our plate size is much greater than we used to eat. We used to eat smaller portions, so we need to really work out a lot more. Now we're saying like an hour, 3 to 4 times a week. Right.
Oh my God.
Yep. And remember, and this is very important, before you start any exercise program, you should have medical clearance by your physician or come to me and I can medically clear you. All right. Especially if you haven't exercised in a long time and you want to get back into a routine. Go into the next
So,
question.
do you prescribe Ozempic for weight loss?
Yep. So we'll go over because you skipped one.
Oh my God, I'm sorry.
That's okay. We'll do that. Yes, I do. All right. So we're going by questions here. So yes, I do that. But why don't we hold off that? It was actually one because that's a follow-up question.
Sorry about that. So how would you treat obesity and morbid obesity?
There you go. Now we're gonna stay.
My fault.
That's okay. That's why we have fun with this, and it makes actually for a good show. So how do I treat it? I always start off conservatively. Okay, I have to do a thorough history and physical, and I also do blood work so I can get a baseline. And you say, well, I'm having a difficult time losing weight. Well, I want to make sure all your chemistry, your blood chemistry, is normal. If something's abnormal, let's say your thyroid, well, let's address your thyroid because your thyroid gland is your master gland when it comes to metabolism. And if you have hypothyroidism, that means your metabolism is going to be slow and it's going to be much more difficult to lose weight. So I need to know, are you taking medications or not? If you are taking medications, is it within the therapeutic range? And if it's outside the range, that means I need to increase the dosage. If you're not taking medications, then we have to consider start taking medications. So I'll give you an example like Synthroid or levothyroxine, and there's a few other medications, but typically I like Synthroid. And then I would start that with the patient on that. And then what I would do is in 2 weeks later, while on the medication, I would repeat their TSH, their thyroid level, and then if necessary, make an adjustment. Maybe either advance it. Again, there are different ways to start the medication. When I say is different ways, is where do we start? Some journals will say based on your weight, you can start it. There is a ratio. I like to start conservatively on the lower end because I can always titrate up because then I can control the titration. Again, it's protecting your patients. Start low, go slow. That's what we say in medicine. Remember, all drugs are poisons. We just control the poison for a specific function. Start low, go slow. After that, well, we want to get into an exercise program. Again, before you start an exercise program, you want to be medically cleared. We also need diet modification and behavioral modification. Okay, so I need to educate you on how to eat the proper foods, like a low glycemic index food. You can look this up. There's online. You can type in, when you have your search button there and put in glycemic index, okay, chart, PDF, and then hit search, and you're going to see a lot of PDFs come up. And what you can do is start opening up those PDFs, and you look at foods that have a glycemic index of 55 or lower. Lower is better. All right, so how do I treat? I'm going to start conservatively. We want diet modification, behavior modification, because I have to train you to rethink smaller portions, and you don't need to eat certain foods. Stay away from certain types of foods like simple carbohydrates and eat complex carbohydrates like fruits and vegetables rather than a candy, like an apple instead of a candy bar. An apple is so sweet when you compare it to a candy bar. Okay, and then we get into an exercise program, and it's all different types of exercise programs. I'm not going to go through all of them, but it's just an exercise program, especially one that has an aerobic activity because we want to burn calories. Just lifting weights, you're not going to burn enough calories. You need to have an aerobic activity. All right, so the next question.
Do you prescribe Ozempic and weight loss?
Yes. And that's the semaglutide, okay? Also known as Ozempic and Rybelsus, okay? You see these on a commercial. These medications are on label to treat diabetes, but they realized that those individuals who are using this medication started to lose weight. So yes, I do prescribe these medications for off-label use. That's off-label use, which we're allowed to do that by law. My license allows me to prescribe medications off-label use as long as we know it's safe. And we know that this is safe. There's a way to use it. It's a titration. You start off with a low dose, and then you start titrating up. And there's an amount of medicine that you're going to give weekly. And once you reach that amount, that's when you're going to really start losing weight. So again, diet modification, behavioral modification, an exercise program, and there's oral medications, or in this case, the Ozempic and Rybelsus, medication that we can inject to help lose weight. All right, so I know we're down to a minute and a half. Pretty much we covered what we need to cover today. So would you like to say anything before we close out today's show?
I don't know. I love doing this. It's fun. This is fun for me.
It is. It's exciting. What about you?
I was a little nervous. Sorry I messed up before, but I'm trying to jump the gun on the questions.
What is a good experience? Because, with your degree, with both of you, this is what you can do if you wanted to have your own podcast or have your own radio show once you have your license, because you'll be licensed to practice. So this is a great experience to help educate the community in your respective professions. And this is a really good springboard to bounce off into. Get into this career here.
Maybe Sam and I can do one when we're
all right, guys.
That's right.
Just wait, it's coming.
There you go. All right, so we're down to the last 35 seconds here. So I want to thank all my listeners for tuning in. I'm a little bit more than a year now, so my anniversary passed last month. And again, thank you for listening and helping me, allowing me to educate the community on health topics. All right, so if you're looking for a physician, or if you want to learn more about Dr. Tommy O, go to drtommyo.com. That's drtommyo.com. Or give my office a call at 631-980-8200, 631-980-8200. Or stop by. Come by and say hi.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.